those of us in healthcare, this question is really the fundamental question. Why are some people healthy and others not? That's really what everyone is concerned about with any kind of training in health. And I think all of us are concerned about health as an issue. So this problem of health inequities then really should be central to what everybody does. But it's not. It's not central to how we educate people. Even here at the School of Public Health, we don't do a very good job of educating people about this. And we certainly don't do a very good job of educating nurses and pharmacists and doctors and lots of social workers and lots of other people. For those of you who are not in the health community, the Healthy People objectives are the national objectives. No, so that means I have to really silence this. This is a new phone. My grandchildren say that one day I'll learn how to use it. It's too complicated. So these are agreed upon national objectives. These are not objectives I would have chosen. They're the sort of middle of the road national objectives. As you can see, even here, starting from 1990 to what's come out in 22, we pretend, first in 2000, that we were going to reduce health disparities. I'll talk more about that problem. In 2010, we said by 22 we were going to eliminate health disparities. I must have slept through that. And here in 2020, we thought it was a great achievement that we got them to say achieve health equity, but they still put eliminate disparities. But, you know. So the point is, this has been a goal, a national goal of our government, federal government, for 3 decades. And we are going backwards. And we're not serious. Okay? I want to, I missed all of the, I'm a horrible sinner and I have no understanding of the faith traditions of any faith. So, I was saying that I couldn't be here this morning and here. Yeah, it's always good. Yes. It's always good to have a few quotes when you go in certain settings. But here's a quote from Frederick Douglass, which is a nice quote. It's not a faith-based quote per se, but I want to give you some of the basic principles about health and that I think the world deals with. This, of course, is the WHO definition of health. Hopefully, many of you have seen it before. Project Brotherhood that I work with, for example, you all appreciate this. They use this definition, except they changed it. They put in spiritual well-being in addition to emotional. So, yeah.
WHO actually debated it and said agreed, but never changed it.
It never changed it, right? So, and I actually do believe spiritual should be in there. So, in any case, in the United States, this is not what we teach as a definition of health. And in fact, I've been in many settings where people say this is an absurd definition of health in the United States. So even though this is a rather benign definition as far as I'm concerned, there are many, many places where I go, especially in the medical schools, where they say, this is not realistic, you can't have that as a definition for health. Most of the world uses the United Nations Universal Declaration of Human Rights as a basic foundation, a basic floor. All of these international documents were argued and debated, but this 25th article, I think, is important. This is something the United States rejects. Look at this. Everyone has a right. It doesn't say a right to an opportunity. I hate when people say that. You have a right to have an equal opportunity to be rich. Everybody has a right to a standard of living adequate for health, well-being of himself and his family, including food, clothing, housing, medical care, and necessary social services. And the right to security in the event of unemployment, sickness, etc., or a lack of livelihood in circumstances beyond his control. This is something that is adamantly rejected by all governments in this country. And if you polled most Americans, they would not agree with this, because this doesn't even fit into our jargon. Okay. Now, I believe most Americans actually do agree with this, but we're schizophrenic. We're mentally ill as a country. Really, we don't understand. This is a definition that I much prefer, and let me just remind you, if you don't know about the People's Charter for Health, Google that. I think this is an organization, I'm going to be talking a lot about the World Health Organization again. A mainstream organization. I'm not against them. But, it's a little bit too mainstream for me. But compared to the United States, they're radicals. The People's Charter is, I think, much closer to my personal philosophy. And again, Ronnie, you're going to be able to send this out to people, right? That's it. So you don't have to. Health is a social. I'm not going to read many slides. I'm going to read this one. Health is a social, economic, and political issue. So when you hear people cry, "Oh, this shouldn't be political," it's a political issue, and above all, a fundamental human right. Inequality, poverty, exploitation, violence, and injustice are the root of ill health and the deaths of poor and marginalized people. It doesn't say, though I would not suggest you do it, smoking is the root of ill health. It doesn't say being fat, like me, is a root of ill health. It lists those things as the root of ill health. Health for all means that powerful interests have to be challenged, that globalization has to be opposed, that political and economic priorities have to be drastically changed. If you're not talking about this, in my opinion, you're not talking about health. And if you're not talking about health, you can't possibly address health inequities. So what are we talking about? Well, you gotta admit where we're messing up. And I don't have time in this time we have together to go through all of that. You're gonna be going through, again, all of you could stand up here and spend 2 or 3 hours each talking about everything that's wrong. And that's important to do. But if you're not willing to call stuff out and be clear about what's wrong, you're in trouble. Here's another place for you to Google Gapminder. Google Gapminder. They have all kind of nice little interactive things. I'm not going to talk too much about the situation in the world, though I am going to be referring to the WHO report on health equity. But I want you to know this exists, and I want you to be aware that compared to many other countries, we are horrible. We do not have the best healthcare system in the world. We are so far from having the best healthcare system, it's an embarrassment. So, now, we have lots of toys in health, okay? We have lots of machines and CAT scans, and when you have something wrong with you, like appendicitis or something, and you can get to the right technology in the right time, it can save your life. I'm not diminishing that. But we have a horrible healthcare system, and the health of Americans is not very good either. So this is the NIH, the National Institutes of Health. They get all the big money from the federal government. We give more money to the NIH than we do to all of the public health parts of the federal government combined. These people don't know what to do with money. They don't know how to spell health, and they never heard of public health. I'm exaggerating, but only a little bit. So this is their definition. So does it move you? Incidence, prevalence, this is bullshit. This is technical. Here's another definition from the Institute of Medicine. They did that great report in 2002 that said, the sun rises in the east. Health disparities exist. That's what they said. So the point, the only guy I had this up here, this is another definition. But I just want to remind you, whenever we look at groups that theoretically we've accounted for poverty levels, insurance status, race raises this ugly head. That's what that said, first bullet said. Minorities receive fewer procedures of poor quality medical care than whites because they're dark, because they don't speak English. Okay? Not just because they're poor, okay, or just because they don't have health insurance. So if you look at the VA system, you're a veteran, you get help from the VA system, your insurance status is the same. Why would one person with chest pain get a procedure and another person with chest pain not? With the same chest pain, same symptoms. But study after study has shown that this is the case. This is a short definition that I prefer. It's easy to remember. Again, there are lots of other good definitions. Health inequities are differences in health that are unnecessary, avoidable, and considered unfair and unjust. So this brother and me have differences in health. We have different anatomy, different equipment. I'm never going to get prostate cancer. I don't have a prostate. Okay? It ain't happening. He's never going to get uterine cancer. That's a disparity. That's a difference. Is that unfair?
It just is.
That's what it is.
But
We can't. It's not avoidable. Okay? It's not avoidable. So this is only in the United States that we talk about health disparities. I hate the word Disparities just means a difference. This is what allows us to bullshit and not say what it is. And equity sounds like something bad. Disparity, you don't know what it is. It could be good, bad, or whatever. So we need to start using the word equity and inequity. I'm not interested in health disparities, only as a minor technical issue. Okay? I'm interested in what's fair and what's reasonable. I don't want to spend a lot of time on this. I have some graphs later. Let me just stop here. Don't immediately assume that how the data is presented in the press is useful to you. Okay? Sometimes it's just wrong, which is a different kind of problem. But even if it's right, you know, it depends on what question you're asking. This happens to be nephritis, which is a kidney problem, and heart disease. And what this is pointing out is even though not that many people have kidney problems, the relative difference there is 250% compared to only 30% for heart disease between black and white. So again, there are lots of ways to look at these numbers. It's important to understand. You know, it's not important that you worry about it. You can always find someone to explain it to you if it's not in your field. But just be aware that you'll see things in the press, and we'll talk about some of them in a few minutes with some of these graphs. This actually is one that I can just talk about. So, most of you, how many of you have heard about infant mortality problems in blacks? Right? Okay. Now, this is from 1900 to 1990, and the yellow line and the blue line there is blacks and white. Infant mortality for all groups in this country, okay, basically over time has been plummeting. Isn't that impressive? Look how great it's done. Okay? And that red line is the relative inequality. So what this is showing is that if you do the relative inequality measure, the gap between white and black infant mortality has actually been increasing. So you may see something in the paper that says, infant mortality has dropped again. It's such a, and they'll quote, you know, oh, black infant mortality is so much better than it used to be, which is true. But what they may not say is that the difference between blacks and whites is actually getting worse. This is just another way to look at it. Both of these are perfectly legal and accurate. You just have to know what they're talking about. Sometimes the paper will say the absolute inequality, that's that red, that's another way of measuring it, has also dropped. So whenever you read something in the paper, you have to really ask yourself, what does that number come from? What does it really mean? What are they really saying? So this is the questions, these are observations, disparities that we see. Poor people die younger than rich people. That's generally true. Poor infants have lower birth weights. Smokers get more lung cancer than non-smokers. And women live longer than men. So those are generally observable information. The question, for those of you who care about equities, is should these things be true? That's really the question. So, except for that last point, which I'm not sure. I don't see why that should exist. So, let me go. This is some more math. So epidemiologists look at these numbers, and they try to measure the numbers. And if you don't measure them, you don't know there's a problem. So that's another issue. Do you know what your high school graduation rate is in your community? I bet you don't. We'll get to that. If we know the numbers, if we know where they're problems, stroke, heart disease, foreclosure, unemployment, which one should we work on first? Okay? How do we figure out which ones are the more serious problems? What criteria? This is why we have arguments and debate. We're not going to have agreement on it. But if you're not clear in your mind what you're doing and what, so for example, I was just talking to the health center where I see patients, Woodlawn Health Center, which is a building that the county uses and the city owns, and the city's mental health centers. So that's one of those occupied. So the mental health advocates are occupying a little tent city outside of our health center. And, which is, I think is great. However, okay, I will tell you, so the city is consolidating and cutting their mental health centers from 12 to 6. They're not cutting them exactly in half, but they are cutting them. Okay. Do you know what else they did this year that you have seen no protests about? They got rid of all of their physical medicine clinics. All of their primary health clinics are gone. Did you see anything in the press? Are you aware of it?
No.
And again, I'm not trying. I think mental health is critical. I think what's going on is great, but there's not a peep about that. Okay?
So you're saying basically family practice, primary care is basically removed?
That's right. What they did is, I don't want to spend a lot of time on it, they put out a little jive RFP for 1 year with a possible 1 year renewal with a little tiny bit of money, much less than they usually spend, and had people bid on it. So they gave out the bid, so they basically privatized the clinics. Now, the people that got the clinics, the bid on the clinics are good guy clinics. But believe me, in 2 years, it's going to be not a dime there. So the resources shrunk. Much bigger. I'm not suggesting it's more important. I'm just, the point I'm trying to make is, it's a much bigger cut than what happened in mental health. Okay, that's all and we're all sitting here saying, oh, isn't it horrible what they did? Yeah, it's horrible, but meanwhile, and I'm not going to talk about, I don't have time to talk about Ron Emanuel trying to privatize our taxes. I think that's truly amazing. That's what I interpret the trust to be, whatever they call it, the investment trust. I mean, that's really creative. Just privatize my tax money. It is creepy, yes. Okay. All right. So, Burkow, for those of you who are clinically trained, is the father of virology and pathology. He made this quote. He's a great guy. We can't talk a lot about him. Do we not always find the disease of the populace traceable to the defects in society? Okay, I think that's true. And that's why we're here. Many of you have seen this ecological model before, right? What do you think your parishioners would think is the most important circle or eclipse here? Which one? Not what you think is the most important. If you just showed this from the pulpit, what would they say was the most important?
Well, the orange circle, because that's us.
Oh. And you, who said the largest? So you've been brainwashed by your education. So if this were a target, now put it another way, if this were a target, what would most people in our culture think was the most important? The center. Okay, and that's because this is how we are taught to think about these problems. And this is in public health what we pretend we're talking about, the ecological model. This is bullshit. What would happen if we did it this way? Okay? What would happen if we taught it this way? All right? So then if we were talking about where should we start our intervention? Okay? If we taught it this way, we would be starting with the society. This other way, well, I can't go back easily. So it would be the individual. Here's another model, same thing, there are a lot of these. Looks like the individual family members. We always focus on that. This is I shouldn't say it's a problem. It's a tendency of those of us who are involved in caring professions, where we're interacting individually with people. It doesn't matter whether you're doing it as a pharmacist, or a nurse, or a health educator, or a pastor doing counseling. It's the same process. And it is a gratifying and, you'll excuse me, sacred task to work individually with patients and to help them. It's what we do, but it's not necessarily the most effective thing to do. I can't spend a lot of time talking about this. This is the model I prefer. I just want to point out to you that it's a complicated model. That's the first thing. This is not easy shit. If you could just memorize the 10 Commandments, teach every 2-year-old the 10 Commandments, and that would solve everything, we wouldn't be here. Okay, this is not easy. You can see on the right that you have to work on all levels, the individual level and the global level. You don't have to work on them all at the same exact moment. And we could divide them up. Maybe this sister could work on the individual and this sister over here might work on the global. Okay? But collectively, we have to work on all the levels. We have to pay attention at the bottom to what goes on throughout one's life course. Okay? So where you grew up makes a difference. Whether you grew up in the projects like I did, or whether you grew up in a palatial suburb, makes a difference. It doesn't mean one is better than the other. It just it forms us in a different way. And the most important thing is this thing on the left, which is talking about power. She's outlined what I think are the 3 most important, not the only, but the 3 most important criteria on which power is distributed in this country: class, race, ethnicity, and gender. but there are others. So, something to think about. Now, I want to spend some time talking with you for a moment about this mainstream, relatively conservative approach that the World Health Organization has adopted. In 2008, they issued a report, seminal report. It is a consensus document. Most people in the world with any training in any kind of health care agree with most of what the WHO report has to say. So I invite all of you to go Google it up. It's on there. You can download it and look at it. Now, especially if you're going to be working on projects, because they have lots of examples from around the world that I think will help you. So the group that worked on this is called the Committee for the Social Determinants of Health. They spent a lot of time looking at models, and I want to talk about them because I didn't want to just come and talk about the inequities that exist. I wanted to give you some sense of one view, at least, of how they got that way and then what we have to do about it. So when you go on the website, you'll also find lots of background papers. So if you're interested in gender issues, or if you're interested in unemployment, or if you're interested in racism, they call it social exclusion in the world jargon, you'll find background papers on this. And reading about what some relatively poor country is doing about a problem and comparing it to the stuff we're not doing, it'll really get your angry and give you some ideas. So what this framework tries to do is it emphasizes the socioeconomic and political context for how we produce inequities. Because health is not an accident. We produce, in fact, you could look at health and well-being as the ultimate outcomes for all human endeavors, right? Mm-hmm. So the question is, how do we produce it? What makes it? And obviously, in one set of diagrams, you can't include everything, but these are the things that they think are important: the labor market, the education system, political stuff. So let's look at some of this stuff. So they're saying that there's structural determinants of equity or inequity that generate stratification and class divisions. What that means, how do we divide shit up? That's what that's really about. What are the structural drivers that take the resources of a society and divide it up? Okay? In a family, if you can't buy food, does your family feed the children first? Or not? How do you decide what to do? So the context that we had on the other screen, the politics, the history, the culture, and the structural determinants together form the social determinants of health. And health equities or inequities come from how these interact. So let's look at this in the diagram a little bit. So these are the structural determinants of the social determinants of health inequities. And let me just say here, I think we make a mistake, those of us in healthcare, of thinking that the social determinants of health are the same thing as the social determinants of health inequities. They're not necessarily the same thing. Social determinants of health is a much broader concept. Okay. Social determinants of health inequities are specific to time and place. So here we're looking at what kind of governance do we have? Do we have a dictatorship? Do we have an oligarchy? Do we have a democracy? What kind of governance do we have in this country? Democracy. That's right. I agree with you. I think it's an oligarchy. A lot of people, most Americans think we have a representative democracy. I don't think so. Think about what's going on. It's not an accident. As we roll back voting rights, think about barriers being put in place to register to vote that we fought to get rid of in the 50s and 60s. What are the macroeconomic policies? Do we have a position that we will not tolerate more than 2% unemployment? Or do we have a position that we will not tolerate more than 20% unemployment? What are our social policies around housing and land? Our public policies on health and education? Is it a right to have an education or not? And do you have an equal opportunity to education when some neighborhoods and communities spend thousands of dollars on education and others spend hundreds? Where some classes are 15 and some classes are 45. What are the cultural and societal values? So this social, economic, political context is important. And then we have the structural drivers. What's the social hierarchy and how is it based? If you listen to the Tea Party, they'll tell you that the social hierarchy is based on hard work. Okay, that's what they'll tell you. Right. And then if you don't work hard, you deserve to starve. Now that's a value problem, but I'm gonna leave that alone. But the social hierarchy is based on, in this WHO thing, class, social class, power, how much power you have, prestige or honor in the community, discrimination, racism. Okay, if we were Americans, we might use different language that we're more used to. So what goes on in our hierarchy depends on what language you speak, how much your accent is, what the color of your skin is, what your gender is, what your class position is. And Americans don't believe in class. This is why we have trouble, because we don't believe in class. When you ask people what class are you, they all say middle class. Okay? They can own the Hyatt hotels, or they can be scrubbing the toilets in the Hyatt hotels, and they all say middle class. There's a problem there. And this generates your socioeconomic position, how much education you get, etc. So this context and then the actual drivers of how we distribute opportunity and resources determine all of these other things. So when you look at someone and they're a high school dropout with 5 kids, that is not primarily because they chose to do that. More times than not, it's because of all these other factors that help produce that. And here's the intermediate determinants, which you all know a lot about. Now, I think our problem in the United States is we, and especially those of us that try to do good, we get hung up in these intermediate determinants. We don't like talking about the structural factors, okay, because that's dangerous. People start talking about you. You don't believe in God, you're a communist. You know, what that brother say? 81 communists in the Democratic Party. I said, shit, I wish that were true. So we concentrate here. We know a lot. Oh, this person was psychologically scarred because they had this happen. We're good at this stuff, at the intermediary stuff. But this is not useful if you don't know what came before that, if you don't understand what produces that with people. So we worry about, remember the struggles, a lot of you all, the struggle to have rape considered seriously? Except when I was just listening the other day in Detroit, 11,000 rape kits untouched. So did we consider, and there's, I don't know how many is in Chicago, the same problem exists in Chicago, I just don't know the number. You know, so all that struggle. And the reality is, you get a rape kit done and it sits on the shelf. Okay. So the message to women is clear. Women get it. I'm not even reporting this stuff because it's no use. All I do is create more problems for myself. So we have the structural determinants, the intermediate determinants, and that impacts equity and well-being. And here's their policy look. Well, I don't want to spend a lot. What they're saying is you have to have policy interventions at every level. Okay? At the micro level, at the global level, and you have to monitor what you're doing. Okay? Because it's not like we all have the answer and we can just put something in place and everything will get fixed. So here's the Ottawa Charter's prerequisites for health. These are a good list of social determinants. Again, I would argue this is not what we emphasize in our training of health professionals in the United States. We don't spend a lot of time talking about peace. We spend a lot of time talking about education and food, you know, and exercise. That's not up there. You know, that's what we spend time talking about, right? And we yell at people. It's, you know, this is like the worst preacher. Excuse me, I don't know how many Baptist. It's like the worst Baptist preacher, public health. You know, I think we channel. You know, we just get up there. Don't eat calories, 5 a day. It's horrible what we do. No wonder nobody listens to it. We never talk about, rarely talk about social justice, equity, but these are prerequisites. They don't guarantee health, they're prerequisites for health. So I want to talk about social class a little bit. In this country, we don't like the word class. So we use this word socioeconomic status. It's the same thing as what?
Class.
It's class, okay? We're not middle class. Most people the biggest class we have in this country are working class. I don't know why people are ashamed to say that I'm working class. You know, maybe, well, I don't, that's another lecture. I don't know. It's too Marxist. That's right, it does sound too Marxist, but that's a useful framework. In any case, so in this country, we mix all of this stuff up. We talk about SES. We mix up wealth and income. What's the difference between wealth and income? Income is how much somebody pays you, right? If you have a job, okay? Like Romney doesn't have he earns most of his money off of interest, but last time I looked, he was unemployed. So his income is really small, but he has a lot of wealth compared to me, right? Okay. So let's just look at some of this. Economic status, occupational status, educational status. Part of the components of class, they're not the only components. In Ireland, religion would be important here, for example. So what components are important to class, which includes status? Depends on where you are and what the culture is. But let's look at this for the United States. So we know that the rich have gotten richer. Now, many of you, especially if you're biblically inclined, may think this is always the case. But the reality is this has not always been the case, okay? And that we're in more trouble today than normal. The life expectancy gains in the recent period from 72 to 2001, much more to the wealthier folks. So they're not only rich, they live longer, they do better. This should not be a surprise to us. The disparities in life expectancy by grouping, this is a comparison of the top to the bottom, is growing over time. Now, this is a remarkable thing to have these changes come in such a short amount of time. We're really in trouble. And again, just how much wealth has been accumulated over time, where the wealth is. And you can see the lowest fifth have lost money. They're in worse shape. They died in debt. Okay. Most Americans' wealth is tied up in their home. That's the thing that you really, for most people, there's some exceptions. So income is an important thing. It varies by time. Students have low income, but depending on what kind of school they're in, they're not going to always be low income. So income is just how much money you make today. You get laid off from your job, your income goes down to zero. And wealth is how much you accumulate. I just want to remind you, in this country we talk about the federal poverty levels. This is a stupid measure of poverty. No other country does this. Molly Orshansky was a nice lady. She's dead now. She was given an assignment one day when she worked for the government, and they said, figure out what you would do as a temporary emergency if your family had no food. How much money would you need to just as a temporary emergency to go to the grocery store and fill up your basket? That's where the federal poverty level comes from. That's why it doesn't include things like how much rent is in New York versus how much rent is in Peoria. Okay. It doesn't include things, right? It doesn't include things like what do you need to take your child to the Museum of Science and Industry on a weekend? Okay. Now, when I first came to Chicago, you didn't need nothing. Okay? Now you need a whole lot of money. And if you had more than one child, you're in trouble. You got a car. Oh, it's horrible. Okay, so it doesn't include things. It doesn't include what you need to live. So when you hear people talk about we're going to provide this for people under 100% of poverty or 200% of poverty, know that that's a horrible way to think about things. This is data from 2005. Just to remind you, the median income, the middle income varies by race. And this is, again, this slide just to say that you can see how narrow the lines are to the left in 1970 and how they've widened in 2005. It just means that the inequality, the gaps in people's income in this country is growing. We're one of the worst countries in the world, in the industrialized world, for this gap. Occupational status, obviously. And a lot of times this doesn't have to do necessarily with income. In some communities, being a person religious as an occupation has high status, even though in most faith organizations that I know it doesn't present you with a whole lot of money. Okay. The drug dealer that may have a lot of money has low status. Okay? So status and income are not always exactly the same. I'm not going to spend a lot of time talking about this. This, I think, is a major problem in our country. It is a major reason why we're in trouble, and that's because the number of people who belong to unions has plummeted. And in labor, we'd like to lie, so let's go, to be honest with you, in the private sector, okay, we're way below 10%. We're like around 7% of the private sector workers in this country are unionized. When you throw in the public sector workers, which have a higher rate of unionization, it gets up to 10 or 11% or whatever. You know, it's bad psychologically to go below 2%.
And would a primary factor in this also include the fact that most of those public sector jobs have been farmed out to literally to foreign markets?
No, I'm going to give you a quick history lesson. So, as you know, in this country, the private sector was unionized first. The private sector had health insurance first. The private sector had defined benefit pensions first. And then over time, they started losing all those things. They started reneging on their pensions. The public sector lagged behind, and still do. This nonsense where public sector workers make more money, not if you adjust for education. So public sector workers make less money compared to their appropriate peers. And they still have higher unionization rates now. They didn't a few years ago. Now they have higher unionization rates. They have contracts and protection, and they have the pensions. So if you want to get rid of those things, that's why you need to ask yourself, how come all of a sudden there's an attack on school teachers? Right? All of a sudden firemen are evil. Eating up the, think about what that means. You know. I think one of the reasons we're in trouble like this is because we've allowed racism to exist in this country. The whole concept behind unions is that you unite. When you allow racism to divide people in this country, and poor white folks, working class white folks, are willing to vote for idiots that are screwing them to avoid being connected with Mexicans or blacks, we have a problem. That's just my opinion. So this is a horrible slide. I'm going to take a minute with it. This is education and educational opportunities. These are poor. These are from 2 years old to about 12. These are poor kids. Excuse me, I'm going to be incorrect. Poor dumb kids. At 12, they're still poor and they're still dumb. Low IQ scores. Dumb rich kids, okay? Equally dumb at 2. At 10 or 12, look, okay? Here's bright, poor children. They go to our schools, and our schools dumb them down. Look where they are at 10 or 12.
Come on.
And of course, if you're bright and you choose the right parents with enough money, you're in good shape. This slide ought to embarrass all of us.
Yeah.
Okay?
Yeah.
This is not education leveling the playing field. This is your economic status determining how much you know. And in this case, these happen to be IQ scores. Another thing, college completion rate. Now again, the so-called graduation rates and college completion rates have been improving for all people over time. But look at this. This is black, white, black, and Latino. For blacks to reach where whites are today, and look, whites ain't in great shape. They're only at 32%. This is from 2007. It's not till the year 28 would that happen. And for Latinos, 3,000 years, 50-50, for them to get to parity. Okay. Think about what that means. So are we serious about educational opportunities? I don't want to spend a lot of time here. When we look at a lot of different studies, the income, which is what we use here in this country for a proxy for class, you can often see health problems going out by income. So class is a big deal. And I want to talk now about racism and segregation. I put this up to remind us. I haven't corrected these. This is from 2005. So add another few years. And this is especially for young people. Most of our times as blacks in this country have been in slavery. And when people stand up and say, "Well, y'all ought to be over that by now," I just look at this graph. What are you talking about? Even post Jim Crow from '60, it's only a few years. Many of us were born in this room when the country was still segregated. Okay. This is real. My great-grandmother was born the year after emancipation. she could talk to me about what the country was like. Now, of course, my son never met her, but it's within my physical memory. And you can have a graph like this for all of our folks, whether you're Native Americans, Mexicans, Puerto Ricans. So the notion of genetic inferiority, though this happens to be a leading doctor in 1851, is alive and well. And here's something where I think Brother Barack is wrong. In his eloquent speech on the nature of race in this country that he gave in the first, he said racism is not endemic to the United States. That's a young man who fails to understand the history of the United States. If we're not willing to call this out and say it and address it, we're never going to make progress. So SES and race, in my opinion, and in many people's opinion, are two independent factors. Obviously, in this country, there are more poor people. That is to say, the percentage of poor people who are people of color is higher, even though most poor people are white in this country. So it's not that they don't relate to each other, but they operate independently of each other. But both class and racial difference here, you can see where class differences, sort of the numbers in black, appear to be bigger than some of the racial differences, but the racial differences don't go away. Let me get to my end. This is another shame. This is infant mortality. It hasn't changed, it stopped to 99, but it really is going sort of in the same direction. So this is what the infant mortality is. These are white women with some college education or higher. They have the best, being low here is good, they have the best infant mortality rate. White high school dropouts and white high school graduates and white high school dropouts in red. This is the gradient that we usually see. It has to do with opportunity and resources, okay? But you notice, white high school dropouts have better birth outcomes than me, a black woman with lots of college education. Okay. Race and class are not the same. They operate in complicated ways, and they operate differently on different diseases. Okay, so this is saying the same thing. So we should just remember what segregation meant. These pictures are from Chicago on Wentworth. This is what people moved here from the South. This is a basement with cardboard walls put up in the basement, and families live behind these cardboard walls. This is the race riot from the race riots of 1917. So let's look at today. This is 2008. This is a graph of how many children live with poor families and in poor neighborhoods. You have to be a poor family and poor. So only 1.4% of white children who are poor live in poor neighborhoods and poor families. For blacks, it's almost 17%, and for Latinos, 20%.
How is poverty defined in this?
I don't remember to be, well, poor neighborhoods, they give you that. Okay. This is probably poverty level, probably federal poverty level. Okay. But poor neighborhoods are poverty rates over 20%. That's how they're defining poor neighborhoods.
Okay.
So think about that. That's why it's not enough just to talk about class. If I'm a poor white little girl, the chances are overwhelming that I'm living in a neighborhood that's not poor, that might have a library that's still open, that has books in it. Okay? I might go to a school where they actually teach you how to read. There might be a park in my neighborhood that I can go to, and activities I can participate in. Okay. That's what we mean by the structural determinants of health inequities. Here's another look. Kids that go to schools that are dramatically different racial composition than whites. In other words, who goes to segregated schools? We already know this. Mm-hmm. Okay. Here's something from Metro Chicago, not just the city, but the neighborhood. It's the same kind of look. So at the bottom, that means 0 to 10% poverty rate in that neighborhood. So look at where the white kids are clustered. Most of them are in the neighborhoods with less than 10% poverty. Okay? And you can see what happens with black kids and how they're stratified. We're leaving aside the fact that in South Shore, you may not have the same stuff, despite the income level that you might have on the north side. We're going to leave that alone right now. Too complicated right now. Similar kind of thing, poverty composition. Poor children, that other one was all children, this is poor children. So if you look at poor whites, still most of them live in communities that has less than 10% poverty. And you can see for blacks, most poor black children live in neighborhoods where over 40% of the community is poor. This is how you create health inequity. This is all black and poor. So I think these graphs are fascinating in their recent data. So segregation residential segregation is a historic marker in the United States for racism. It's not the only marker, but it's an interesting and useful thing, and it allows us to look especially at children and education. And here, whatever we do in this area, pay attention to history. Pay attention to history. So when the foreclosure crisis is at its height, and some idiots are complaining, we don't want to help those people, they shouldn't have taken out the mortgages. I worked hard for my mortgage. Do they understand that the only reason we have mortgages is because we made changes at the federal level? That in 1900, nobody gave you a mortgage? You paid cash for your house, period. And then when they passed the legislation, and I'm sorry, I don't have my notes, I can't quote the federal law or the year, but it's the same Homestead Acts that opened up the West. They had in the legislation, do not lend to no Negroes. You're not allowed to give Negroes mortgages, especially if they might buy a house somewhere where a white person is. That was in the federal law. And then we have nerve to wonder about the foreclosure crisis and the foreclosure rates and why there's not wealth in black and Latino communities. African Americans are 5 times less likely than whites to live in census tracts with supermarkets. It's not that food deserts mean you're going to starve to death. It's a question of convenience and access to care. So don't talk to me about it. It's bad enough that when you get to a supermarket, the vegetables are more expensive. You're being a vegetarian is very expensive.
Yes.
Okay.
Thank you.
I'm not against being a vegetarian, I'm just saying, it's expensive. Black and Latino communities have fewer parks, fewer green places. All of these things work together. These are negative effects of segregation. We fought to integrate the schools not because we wanted to sit next to white people, but because we knew that schools with white kids might have books, okay? They might have a gym. They might have a swimming pool. That's what the fight was about. It wasn't trying to marry nobody. So this is the map of foreclosures. It's in 2000 and between 1999 and 2006. First thing is that foreclosures are going on everywhere, but red is the worst. But you can see they're grouped where people of color frequently are and where poorer people are. So these racial differences exist. They exist in all persons of color to different degrees and different diseases, but they're there. And one of the real problems, especially immigrants have in this country, is understanding that racism is alive and well. So one friend of mine he was born and raised here. He's born and raised here, but his parents immigrated from India. And he works at Northwestern. I'm gonna put it all out there. He's not a doctor. He works at Northwestern, and he was getting so frustrated because his department kept passing him over for promotions and stuff. This is a dark Indian. He said, I just don't know. I said, boy, that's called racism. That's what it's called, right? So even when you adjust sometimes when you adjust for class, racial differences may go away, but not always. Just remember, they do operate independently, and they operate in complicated ways. So, I just wanted to say something. We should have single-payer health care, this present health insurance, which I hope the Supreme Court doesn't throw out, but it will not solve the problem. That's another lecture. Let me go back here. I want to say something. Maybe I can go back.
Other way. The other arrows.
Oh, the other arrow. Oh,
yeah,
okay. I just wanted to say, who knows when Hispanics were invented? They were invented. Who knows when? Relatively recently. Yeah, the 70s or 80s, okay? This is some shit white folks invented. They used to say Spanish surname. What is that? It doesn't mean anything. Okay, but anyway, the point I wanted to make, that yellow bar, this is diabetes rate, are Latinos put together, but you see the differences. Cubans are the small bar, and then you have Mexicans and Puerto Ricans. You have to break it out. What does being black mean?
Come on.
What does it mean?
Come on. Right. Just of African descent.
Does it? Now, in 1920, if there was an article that said black people had a rate of this and that, I would know sort of what that meant. Do you know what it means today? How many African immigrants are in there? How many people from the Caribbean? What does African American mean? What does African American mean? Who here is African American? So what the hell does it mean? What does it mean?
It's supposed to be of African descent, living in America.
Okay, okay, work with me here. So,
Everybody can say that.
a person of African descent, let's just even go even more restricted. Slave ancestry of African descent.
Thank you.
Living in America. How about born in America? In the America. Okay? So where do most African Americans live? Where?
You mean urban areas?
Where? I'm asking where. Just a simple question. Whichever one you want. Where do most African Americans live? The southern states, like Mississippi, Alabama.
Urban areas.
Urban areas like New York or LA.
And the poorest areas.
Where?
And the poorest areas.
How about all wrong? What language do most African Americans speak? No.
Or American?
No. American? No.
Tell us that we don't speak English.
No. Most people of African descent, descended from slaves, born in the Americas, that means
Spanish?
Americas,
Okay.
are most likely to speak Spanish or Portuguese,
There you go. Okay.
live outside of the United States of America. They live everywhere from Canada down to the tip, right?
Sure. Yeah. You're right.
Only 4% of the Atlantic slave trade ended up in the United States. Only 4%. Think about how we get brainwashed into what we're doing. We're bad because we're in the master's house. So like we define African American. Right? Learn how to speak English. Okay? Don't be immigrating here taking our jobs. Think about that. Right? And we don't even know who we are. Go to Havana and you'll fit right in.
Yep.
Okay. Oh, I know what this is.
Come to my neighborhood.
I can tell you that the slide I just went past too fast was a study. I've seen this. This happens to be a study of children and adults, but I've seen it even with just children. This is a study in the emergency room of people who broke their leg or their arm, one of the long bones. So it's not a mystery you're faking it. Like you have chest pain, maybe you're faking it. You have stomach pain, this is a broken bone. So like in medicine, we sort of know the bone is broken or not. Take an x-ray, the bone's broken. And it looked at who got pain medication and who didn't. And Latinos, and this group, Hispanics, were 5 times less likely to get pain medication in the emergency room than white folks.
And that's adjusting for language barriers, anything else.
It's a broken bone, and you're screaming. What language barrier do you need? So, make no mistake about it, even in the narrow notion of what we do in medicine, time after time we find these differences. And let me tell you, there's been some studies that look at black doctors or Latino doctors. Differences don't go away, they may be a little less. So here's an approach that we have toward healthcare. This is what I tell my patients: don't smoke, eat healthy. Okay. You can't be against that suggestion, right? Practice safer sex. This is what we should be telling people. Don't be poor. Don't have poor patients. If there's one thing you could do in life, that would be the one. Don't have poor parents. Okay?
So I said pick my parents.
Pick your parents.
Pick my rich parents.
Yeah, pick your rich parents, and preferably rich white parents. You know.
Make money Spain too.
All right. This is to remind us that the so-called unhealthy food, I hate that word, has been subsidized. The reason people eat sugar and red meat is because we made it cheap in this country.
That's right.
The largest health bill in the United States of America is the agriculture bill.
Yeah.
So if you want to worry about health, pay attention to agriculture. All right. Fruits and vegetables, we have them subsidized, they're more expensive. If tomorrow, Jesus or your favorite deity came down and waved a wand and everybody immediately started eating the way public health wants them to eat, we wouldn't have enough fruits and vegetables in the United States of America to feed.
No.
Okay? Because we've subsidized those other things. So it's not about people driving past Mickey D's. Mickey D's doesn't exist because that's what people want. It exists because it's cheap. And you deserve a break today. You shouldn't have to go home and cook all the rest of the So we're to be talking about systems approach, not simply individual choices. Fine, she gave me 5 minutes. I'm going to take 6 or 7. Pay attention to this slide. We didn't get in this trouble by accident. Okay. We may think that we were marching for justice. And we may feel like we've accomplished a lot. But our view of the world is not the only view out there. This neoliberal, don't confuse this with liberalism. This neoliberal view, this conservative right-wing view, it's an ideological position. Doesn't mean, I'm not talking about evil here now. Now, some people are evil, but I'm not talking about that. This is the philosophy of a certain group of people around the world. And this philosophy has been popularized in the United States because we're not very good at thinking of, we have trouble talking about ideology and philosophies. We get all upset. So this philosophy says markets are the most effective allocators of resources in production industry. Have you heard this before? Let the market decide.
Trickle down theory specifically.
Oh, yeah.
Okay. Right? And if you're against free markets, you must be a communist. Now, most of the industrial democracies in this country are capitalist countries, and they believe in a welfare state. Okay, that's not communism. That's a form of capitalism. And someone who doesn't particularly like capitalism, I never forget that. Welfare state is not communist. Societies are composed of autonomous individuals, motivated chiefly by material or economic considerations. Now, I just don't believe that. First of all, one thing I do know, people are not autonomous. Autonomous individuals are dead. I mean, that's just the reality. That's a historical reality. All right. Human beings are social beings.
Right.
And I don't believe people are motivated chiefly by material or economic considerations. But even if they are, we can moderate that. And competition is the major vehicle for innovation. That's why we have to leave the market alone, because otherwise human beings will just stagnate. This is what's driving the philosophy in this country. So the right wing is not going to say they want 2-year-old babies to die because they don't have health insurance. And actually, I don't believe most of them want 2-year-old babies to die because they don't have health insurance. They believe that if you don't force the parents of those 2-year-olds to go out in the marketplace and to fight as autonomous, separate human beings, that the society will be in worse shape. And they believe if everybody did that, 2-year-olds would survive. We have some differences of what reality is. But that's what's motivating them, because this is their philosophical construct. The question is, what is your philosophical construct? I don't think this defines all of American values. It defines a lot of it. It's like individualism on steroids. It's a mental health condition. Americans. So we're the only people that think about that. We actually think rich people are rich because they worked hard. The rest of the world doesn't think that. The rest of the world thinks rich people are rich because they were lucky. Americans think rich people are rich because they worked hard and they deserve to be rich.
They usually start off with advantage, too.
Exactly. So if we're not willing to confront these issues, we're not serious. When we argue about what kind of health insurance we need in this country, or what kind of education system we need in this country, we're having a discussion past these people. Okay? We're attacking a position that they don't care about. They don't have a position that says black boys shouldn't learn how to read. That's not their position.
But they set up a system.
The system is a different thing. They set up a system that actually produces what we know it produces. But their position is, we shouldn't care what black boys learn, because the market determines everything. That's what they're saying. They also think black boys are inferior, which is why they're not surprised or distressed. Think about it. If their sons couldn't learn how to read, they would think something was wrong.
And they build a new
With the system, right?
And a new system.
But they don't care about black boys, so it doesn't dawn on them that something may be wrong because their attitude is, well, you know, they can't read anyway. But their reason for doing it is not because they particularly hate that 5-year-old black boy. Now they may not like the 27-year-old black man that gets on the elevator with them, but they don't really give a shit about the 5-year-old black boy. This is what they're worried about. So what should we do? This is the cover of that Closing the Gap report from the WHO. Here are their 3 recommendations. We have to fight for clear policy that improve daily living conditions, that tackle inequitable distribution of power, money, and resources. This, by the way, is not good for your health when you do this. This can be dangerous. People get fired and shot, you know, other things. And we have to keep track of what we're doing. Don't do something and think everything's fine. Lose track of the fact that we're losing our voting rights, okay? Or losing our health insurance. So we need policy in all of these areas. I think starting with the early life is important. Now it's really hard to feed the child without feeding the parents.
Come on.
Okay? We try to do that. I don't know why we think that's going to work. Okay? So when you support children, you're really supporting the family. Okay? Literacy, public tuition policy. Why do children have to go in debt to go to college? Why is that? Okay.
Why do you have 1,100 slots for 30,000 kids in the public school system in Chicago?
Exactly. You know, so obviously we're killing the seed stock, but we're not educating the kids. Employment, food security. 1/4 of the people in the state of Illinois are food insecure. 1/4, 25%. Okay. Health services. Housing. How do we allow houses to exist the way they are? With rats and rodents, and unsafe conditions and fire traps. Why is that allowed? And why do you have to pay an arm and a leg to have a shelter over? Income and income distribution. We need a taxing policy. I don't get taxed enough. Now, my mother would say no black person should have to pay taxes. 20 generations. But ignoring that for a moment, I'm a physician compared to other people. I'm not in the same position as Warren Buffett in terms of him and his secretary. But really, you know, Americans as a group are undertaxed. We're not taxed very much compared to other countries, and we get what we pay for. We get no health care, no education, no nothing. Social exclusion, that's the international word for racism. So we have to have laws about racism and discrimination. We have to consciously say we're going to have a social safety net. You know, do we really care that an alcoholic woman is supported if it means supporting her children? You know, or are we going to starve the children because the mom is an alcoholic or a crackhead? Unemployment. Do we have policy that encourages labor unions? Because when you have labor unions, you have people protecting their jobs. So we know what we have to do to reduce the health inequities. It's not a secret. It's not any different than what we fight for in other arenas. The last point, almost at the last slide. Okay. The last point I want to make is this. This is not a problem of poor people, or Puerto Ricans, or Mexicans, or blacks. It's a problem of everybody. The social gradients that we saw exist across the whole spectrum. If you wipe black people off the face of this country, which some people would like to do, the reality is that if you're lower middle class, you have poorer health, poorer education, poorer opportunities than if you're middle class or upper middle class. The gradient affects everyone. It's not just there's the poor in the street, let's do something for them. That's important. But the reality is that the resources in this country are allotted in a clear gradient. And the lower you are on that gradient, the worse shape you're in. And that goes to your children and your children's children and your children's children. So this is one of my favorite quotes of Dr. King, and I'm in here. Rarely do we find men who are willing to engage in hard, solid thinking. There is an almost universal quest for easy answers and half-baked solutions. Nothing pains some people more than having to think. These are difficult problems. They weren't created overnight, and they're not going to be solved by one single approach, whether it's education or health, go to church, or can't we all just get along? It's going to require all of us. We're not going to agree on exactly what needs to happen and what order it needs to happen. But if we're not willing to confront, as a country, racism, class discrimination, and gender inequalities, as well as all the other problems we have, then we have no hope of even leaving our children with a world that was like the one we came back. We're going backwards. Our children will probably live shorter lives than many of us. They'll be poorer educated. And when I think about this, I really find myself struggling to fight battles that I fought when I was 18 and 24 and 26, like many of you in this room. So those of us that have some gray hairs, those of us that are speaking from a faith perspective, those of us that have secure jobs and careers, need to step up and step out. What people often say is the youth lead the revolution. Well, that's maybe been one of the problems, because the youth don't know where the hell they're going. Those of us that are old, that have some clue what's going on, we need to stand up and speak out. We only got a few years left on this planet. Let's put them to good use. Thank you.